My name is Jane Perlman. I've been a pharmacist for a little bit over 30 years and been involved in pharmacy and patient education with a emphasis in diabetes type 1 and type 2. I just want to say that I have had diabetes for almost 40 years, type 1. So fear and diabetes is something real to me. And it's something that's not talked about very much in the medical community. But as you're going to see, it's very important. So just to give you a little bit of background, there are 98 million people in America that have pre-diabetes. 80% of those people don't know they have it. But in actuality, 1 in 3 adults have either pre-diabetes or diabetes. So it's much more common than we might think. Early detection means that more people are living with the diagnosis. So that's why it seems that more people have it. And they have that label. But actually, we're more able to treat it at a sooner time because we're catching it earlier. And along with the diagnosis comes a whole set of feelings. Fear is one of the things that most people that have it feel about what's going to happen to them, if and when it will happen. And that's what we're going to talk about today. So many patients that I speak to, when they're diagnosed, talk about a relative, a grandparent, an aunt or uncle, a sibling that has diabetes or had diabetes. Many times they're not alive anymore. And some of the things that have happened to them. Those experiences are real. And we've seen them and we've experienced them, but they're not necessarily your roadmap and probably are not going to be your roadmap. The tools and medications that we have completely changed. The outcomes are generally more hopeful than the stories you may have heard. Medications work differently. We have better monitoring. The long-term health changes that used to be almost inevitable, we can now prevent most of them or catch them early enough to change the course. That does not mean it's easy, but it means you're playing a different game with better tools. And that's worth knowing about and understanding that what happened to one of your relatives or friends does not have to happen to you now. And things are constantly changing and healthcare is getting better and better. Despite what we hear on the news, new developments and inventions are making it better. Now, I'm not talking about cost. I'm just talking about how people are being cared for and diagnosed and treated. I want to explain to you how we are catching people earlier. You've probably heard about A1C or know what it is. But why does it matter? So when you check your blood sugar or look at a continuous glucose monitor, you're looking at one moment in time. And it's going to go up or it's going to go down. But what an A1C is, it measures, it's a report card for your blood sugar. It's like a 3-month report card that shows an average of the sugar that's been attached to your red blood cells for the past 90 days. So it's a complete average of 90 days of blood sugar. The A1C can't be fooled or changed. It shows the full picture over 3 months. The highs, the lows, the patterns. One good day or one good week before your appointment doesn't change it. I've often seen people that know the appointment is coming up, and a couple of weeks before they'll start eating better and exercising and just treating themselves differently. Well, that doesn't matter. One good day before your appointment doesn't change anything. This is the number your care team chooses to understand how your management is really going. And it's a number that tells us which category you're in. And that's what the next slide is going to look at. The numbers have changed over the past, I'd say, 15 years. So the way that people are diagnosed is changing as well. So here is a graph of diabetes, which you can see is over 6.5%, the red bar all the way to the right. In the middle is prediabetes, which prediabetes is a really new thing. We did not call people prediabetes. It wasn't a thing until they had diabetes. And then you can see the green on the very left is below 5.7%. So this is what's new. We used to wait until an A1C hit 7 or above before telling people they had diabetes. Now we act at 5.7, which is why it looks like more people have diabetes. They don't. This is prevention. We're catching it earlier when we can still change the story. Getting diagnosed in the prediabetes phase is the time when it's possible to find out what you can do about it. But anyway, the A1C is the number that your care team uses to understand how things are going. So fear is not a side effect of diabetes. It's really part of it. It's just as important as your management, but it's something that most people don't like to talk about. But treating it does matter, just as treating the rest of your health matters. Every single patient I've worked with, if I've asked, "Are you afraid?" they tell me some reason. And as a patient myself, I have never been asked that question. When we leave fear untreated, it gets in the way of everything else we do to take care of ourselves. It gets in the way of taking our medication, doing whatever monitoring we have to do, and lifestyles, all of it. So today, we're talking about treating the whole thing. Fear just as much as your blood sugar or what you eat or how you exercise. And fear doesn't wait to be invited in. It hits you all at once, and everybody is different. I wish someone had said out loud much earlier in diabetes that fear is an issue and fear is important. It lands at diagnosis. Some people are just in shock. It gets in the way of what we eat, the medication, and all of the what if, what's going to happen to me. Each worry makes the other things that we have to do heavier. And much of the hardest fear isn't even about right now. It's anticipatory. It's in the future. The what if. What if the same thing happened to me that happened to my dad or my aunt or my brother or sister? What if I can't manage this? That's a lot for us to carry. And I want you to know there is a reason it feels that heavy. It is not a weakness. It is what fear does to people. I often wonder if a patient asked the doctor, "If this was you, would you be afraid?" But very often, it's just something to think about. It's a hard question to ask somebody else, especially when you're nervous and you're in the exam room. But even the doctor is a human being. And you can just think about how they would be if they were diagnosed. You might recognize yourself in one of these. Long-term changes, what I watched happens to someone I love. Losing control of my body, my food, my numbers, my future. And some people, either on insulin or certain medications, may have a low blood sugar that they have to stop what they're doing and have people notice. And sometimes it comes out of nowhere. They may have to treat it with juice or glucose tablets. Because one of the most powerful things we can do is deal with the fear. I'm going to go through 6 kinds of fears that show up again and again. These are 3 of them. So these are 3 more of them. Sometimes people need to start injections. That's very common for people to be afraid of starting injections. For many people, the moment treatment changes, when a new tool is introduced, especially when you give yourself, it feels like the condition just got more serious. It's like a line is being drawn in the sand. And that feeling is real and it's incredibly common. The fear comes and it begins impossible to ask questions. How long will I be on insulin? Will the way that I take it change? Will the dosage change? We don't know what we don't know when we start it, and just feeling so in the dark is helpful. So that is why it's helpful to say, I'm afraid I need help. Okay, the second one, being judged by your doctor, by your family, and the most important one is by yourself. Family members or friends comment on what you're eating. So it's important to feel confident in what you're eating and understand and ask questions. And the judgment of yourself, somehow you caused this, somehow it's your fault. That is the most difficult feeling, I believe, of all. And just because you have diabetes, type 2 diabetes especially is hereditary. If your parents had diabetes, you have a 50% chance of having diabetes. And you may have a sedentary lifestyle, or you may have gained weight, but also the way your body processes insulin because of your heredity is different than even an overweight person who doesn't have diabetes. This is what we need to understand, and how to understand how our hormones and insulin is working so that we can do the best with what we have. So if you're diagnosed with diabetes, I often say we have to play the cards we're dealt. It's not a choice. It's something that is most commonly hereditary. But understanding what's happening to your body and why it's happening, and facing it and looking into it, can make the whole situation more understandable and the situation known, what's happening to you. The last thing is the unexplained symptom. Very often people have fatigue if their blood sugar is not running in the normal range. They're tired. They may be short with people, and they're not really themselves. You don't really know what's happened to you, and it's good to say, is this my blood sugar? Not knowing why your body feels a certain way is very confusing and very complicated. So if we can identify the feelings and the symptoms and be able to present them to our healthcare practitioners, it makes a big difference. Being able to communicate how you're feeling and if you can get help. And like I said before, the fear may be inherited. Um, it's all a package. We're all a product of our genetics, what we inherit, and how we've been exposed to it. So if you've been exposed to a relative or a friend who had diabetes 10, 20, 30 years ago, and you see complications, your fear is even more magnitude. So this is a comment from a woman that has had type 2 diabetes for a long time. And she said, I want to live long enough to be old and wrinkly, but healthy, thriving, and still kicking it. So it does not have to be the end. It does not have to go on to complications. And here's something worth sharing. Research commonly shows that vision loss and limb complications, and also kidney issues, are the most feared complications and issues that can happen with diabetes. But the truth is, heart issues, cardiovascular issues, account for about 75% of deaths in diabetes. Patients are often not worried about the right things, not because they're wrong, but because nobody told them. That's a conversation worth having with your care team, not to scare them, but to help you put your energy in the right places. And when it comes to your care team, there are times when patients will say they're not comfortable talking to their doctor about their fear and their emotions. They feel judged by how they've been spoken to in the past. So often there are other people on the care team. Sometimes there's a nurse practitioner or a physician's assistant, or even a medical assistant who's not as educated. But all that you need is to find one person that you feel comfortable in that medical team to say, hey, I need to discuss something with you that I haven't discussed with anybody else. And it's hard for me. Often saying it's hard for me gets people to listen. And this is a little silly, unrelated thing about saying it's hard for me. Often if I've been in a coffee shop or a restaurant and the waitress says, this is my first day, automatically, I think people become relaxed and understand that this waitress or waiter is struggling and they want to help. And I don't think this is any different than anything else. Finding the right person and maybe practicing with a friend or a relative before. It's really hard to say you're afraid, but preparing and saying you're afraid and getting the right words for someone else to understand what you mean makes the treatment much easier for your healthcare provider. Just saying I'm afraid of what can happen is not enough. I mean, you could say, I just heard that heart issues are the most likely complication. Am I doing the right thing? How can I feel better about this and get some help to see that I'm going in the right direction? It's very hard, but practice makes it a lot easier. Sorry about that. So, scaring people into actions doesn't work. I've often seen TV commercials. You see dialysis centers. You see people that are in wheelchairs. This is a little blurb about a patient that had type 1 diabetes, which was called the juvenile kind, the kind that I have. And she said her doctors used fear to describe risks her whole childhood. She heard all of it. And she stopped believing it would happen to her because she heard so much. At 20 times, she was diagnosed with stage 4 retinopathy. And that means difficulty with her eyesight. She had her first bleed in her eye, and the shock was total. She was completely in shock. Now, that doesn't have to happen. And I want to just tell you, in 40 years, I have not had that happen. But just to add something to the slide, that we have treatment now if something like that happens. And the best way to treat it is to go to a doctor right away and make sure you're having yearly eye exams. And to me, the eye exam is the hardest because you're directly looking for something that's a complication. But what's worse than going to the eye doctor, the ophthalmologist, or the optometrist is having a bleed in your eye. This way, if you go, they can first work on preventing it. It doesn't have to happen. So what works is getting all the honest information that you can and understanding that the information can be put to good use or not. It may apply to you or it may not. But if you don't know, there's nothing you can do. And although it's confusing, I like to say that most people don't know what they don't know. So they totally don't understand what's happening to them, and they're just afraid of what they've heard or what happened to someone they know. So the biggest thing with a diagnosis of diabetes, long-term or even a new diagnosis, is just to learn. And you can't learn everything at once. So you have to just keep going back and learn a little bit at a time so that you can understand it and you can understand how it applies to you. Fear just doesn't feel bad. It changes what you do. There are people that run high blood sugar on purpose because they don't want to have low blood sugar. It feels like they're protecting themselves because they don't want to have the fear of having low blood sugar, because that feels like a loss of control. It feels like they're protecting themselves. But over time, those high elevated blood sugars are what causes the very health changes that we're trying to avoid. It's a trap. I've been in it myself, but it's totally motivated by fear. And this is one of the things that a practitioner can help you with. Like everything else, you're not alone with this. This, as you see, this is a common thing that happens. The next thing, putting off treatment changes because somehow starting them makes it feel more real. Sometimes people put off starting a new part of their treatment for months, for even years. They just don't want to face that their body's changing. Excuse me. Sorry. Sometimes starting a new treatment makes their diabetes and their treatment seem more serious. The delay has real consequences, though. And I want to also say that it's important to get clarification that sometimes you start a new treatment because there is a new treatment. There is something better. It doesn't mean that things are getting worse. It means that things are evolving and things are being developed. But often in the exam room or with a practitioner, we get so scared that we can't understand exactly what they're saying. And some people avoid their doctor. They don't want that A1C. They're afraid of being talked to negatively, feeling insulted or badly about their behavior or how they've been treating themselves. They don't want to hear the reaction. Like, how many times have I told you? Kind of thing. They just don't want to be judged. That's another thing to think about. If you feel judged, you need to say it. You need to tell the people that are judging you. And if they don't react well, then it's starting to start thinking that I need to change how I'm being treated or where I'm being treated, or find somebody else in the practice. I'm so sorry.
Do you need a minute, Jane?
No, I do. I do.
Okay.
Hold on.
That's fine. We'll just give her a minute. I did see Janie in the chat. Welcome to, is it Teresa? It says Teresa. I feel like it's Teresa. Let me know if that's right. And Esther, glad to have you guys back. It matters, but I understand it does not impact me. Okay. Someone is typing. Hi, Esther. Okay. So far, and Janie, I'm not sure what. Maybe I missed it, but you said it matters, but I understand it does not impact A1C. What do you mean about that? I know it's in the previous slide, or maybe you were sharing. Oh, okay. From starting healthy habits late. Okay.
Hi, I'm back. Thank you for your patience, everybody.
No, you're fine.
We can get to all these questions, and please keep them coming.
Okay. Yeah, it was just I was trying to figure out what she meant, but okay. If you're ready to jump back in, Jane, I'll
Okay.
put myself on mute.
You know, and while we're talking about questions, I encourage you to put feelings, questions, fears in the chat box, and we can talk about them. You know, we're really all more the same than different. If you have a fear, often other people want to hear about it as well. Okay, we talked about running high blood sugar on purpose to avoid lows, putting off treatment changes because starting them makes it feel more real, or like my diabetes is getting worse, which may or may not be true, and avoiding the doctor because they're afraid of the numbers and afraid of the reaction. And the fourth thing that we didn't talk about is going silent, hiding it from family so you don't worry them, which gets lonelier. Dealing with family and loved ones with the diabetes is very difficult. They're not necessarily in your shoes. They care, they want to help you, but they don't necessarily understand. Carrying all of this in complete silence is probably more difficult than anything. None of this is a character flaw about who you are. This is just what fear does. And this is why it belongs in the treatment conversation with your doctor. Support groups, other people that have diabetes. You know, I volunteer at a camp for children with diabetes. Some of them for a whole week are with other people, adults too, that have diabetes, and they're not with anybody the other 51 weeks of the year. And I often sit a group of them down and I say, what are things that other people say to you at home and school that make you feel badly? And how do you answer them? I encourage you to put a few of those down, or let me know if you've heard any of these things, like, should you be eating that? Well, with these children, we talk about what should your response be. Um, well, some of them say, yes, I know exactly what I need to eat, and I take good care of myself. Of course, some of them get a little angry and or a little sarcastic. And if someone says, "Can you be eating that?" They say, especially to a sibling, "Watch me," which of course doesn't educate anybody, but it makes you feel better. So please let me know if you've had friends, relatives watch what you put in your mouth, tell you things about how you should be managing diabetes, which doesn't necessarily go along with what your care team says. This is very real. And having to hide what you're doing, hide your diabetes, hide how you're treating yourself, is just more weight on you, more things that you have to do to deal with people that are adding to the fear and adding to make you feel badly about yourself. So there are dozens of kinds of fears. The more words you have to describe them, the easier it is to manage it and talk about it. Very often we don't really think about all the things the fear would be. And that's why I'm giving this talk, because I really want you to think about what you're afraid of. Can some of these fears be alleviated by knowing the truth? I often think that we're told things in the way that we have to be perfect. And that if we're not perfect on our diet, on our medication, then we're not doing a good job. But perfection is impossible. And we all mess up. We all forget to take our medication sometimes. And that's why, as a pharmacist, I encourage people to have those little plastic, they used to be 99 cents at pharmacies, Sunday through Saturday, plastic cases to have their pills in, or two of them if they take things more than once a day or twice a day, 3 times a day. Everyone's a human being. We forget it. The top doctor at the top hospital in this country, I guarantee you, forgets at least once a year whether they took their medication. So aids like this for remembering is helpful. And often the fear comes from, we can't be perfect. We can't do this right. Everything takes time to learn. So being fearful of not doing it right is normal. It's just being a human being. So this is really important. When we talked about naming fear, here are 5 things that can actually help. And I'm sort of repeating what I've said in the past, but if you want to write these things down or take a picture of it, I think that it really helps people get in touch with the fear and make the fear less pronounced. Really, you're never going to get rid of the fear because, I've had this fear for 40 years. But as I work through it and as I name it, it really does get easier. So the first thing is name it. The simple act of labeling a fear takes some of its charge away. That is not a soft idea. It's kind of part of your brain science. Named things are easier to work with than unnamed things. If you don't have any idea what it is, then it could be anything. It's kind of scary to think about it that way. So if you can name, I'm afraid that my kidneys aren't going to work. I'm afraid that I'm going to lose a toe or a foot like my uncle did. Write it down, name it, talk about it when you go to your doctor. What are the chances of me having this? The doctor might say, the way you're taking care of yourself, the chances are very unlikely. Or if you do this, the chances are very unlikely. It's helpful to have something to change to help you alleviate that fear. Like I said, get specific with your care team. I'm worried about my blood sugar is a starting point. And like I said before, I'm specifically afraid of what happened to my father is going to happen to me. That's a completely different conversation than just saying I'm afraid or backing up or not showing up for your appointment. Everyone has relatives and friends that they've seen things happen to them, and it makes it more real. But this is a little bit more difficult. Choose a provider who goes there with you. You have to be in a position that you are allowed to ask for questions. You're allowed to go over your questions. And when you see a provider, or even if it's a provider you're seeing, ask them, how can we set a time for me to ask my questions? Very often, physicians have portals or places online where you can email them. You can send them all your questions ahead of time so that when they see you, they already know they're coming. Or you can remind them, I sent you questions. You're allowed to say, I need us to talk about this, not just my numbers. Because it is easy to get in there and have them just talk about your numbers. You're allowed to expect a practitioner or someone in the care team to answer your questions. Very often I tell people, don't put them on your phone because it's easy to forget and you have to take your phone out and it takes longer to get the questions off. Get a piece of paper, any piece of paper. I use the back of an envelope. Write your questions down, 1, 2, 3, 4, 5, on a piece of paper. Sometimes I see physicians look over the patient's shoulder. They want to read the questions with the patient. It helps them too. It helps them to narrow things down and be more patient-friendly in what they say. Physicians forget that they're using words that patients may not be familiar with, and they need to change how they speak. One of the good things about being a pharmacist is I talk to people, more than I talk to doctors. So I hope that there are things that I'm making clear here and that I'm not using any words that are just medical and aren't usual to everyday life. So number 4, mental health is part of your care. It's not separate. It's legitimate. It's an important part of the whole picture. Many of us have been raised in areas, past generations, where they don't want to talk about how they're feeling. People don't want to talk about depression or anxiety or a mental health issue. But if you think about it, having problems with your diabetes or being diagnosed with diabetes is just being a human being. If you get sad, if you get anxious, if you get depressed, it's really normal. And that mental health stigma is something of the past. The embarrassment that in my generation we have felt about mental health, things are changing. It's really important that we understand that your mental health is just as important as your physical health, and to put it to the head of the conversation with your doctor. And number 5, don't carry it alone. Peer support consistently shows up in the research as one of the strongest predictors of better outcomes. Find local meetings, church groups, community groups. Look online. See if there are some in-person groups or some online groups where you can see people and that you can talk about how you deal with certain things. I've run some support groups in person at a local clinic I mean, things come up like, hey, look, I read this label. I had no idea that there were 5 portions in this bag of potato chips. I thought the whole thing was 1 portion. I mean, that's a silly little one, but it's everyday life things, like thinking, well, why is my blood sugar so high and not realizing that I ate the whole bag? I mean, that's nothing to be embarrassed about. And it's kind of nice that somebody else is telling you that's what I did. I mean, sharing recipes, making life easier, even explaining to people what I'm going through. Is anyone going through the same thing? Really, really does help. I've sat in a group of pregnant women who are having babies and they're afraid about their blood sugar. It is amazing how these women talk to each other and how much it helps. Okay. So let's talk a little bit more about complications. And I want to say, complications isn't a dirty word. They shouldn't be hidden. And believe me, I understand why you would want to hide them, why you would want to not tell anybody. So that's what I'm saying. Finding other people or being in a group, it's the kind of support that even the best clinician can't always give you. It comes from other people who are living with the same thing. Peer support works for a specific reason. It's empathy from the inside. It's talking with someone that can say, look, I'm standing in your shoes. I'm going through the same thing. My husband or my wife really cares and tries to be helpful, but they make me more stressed. How do I deal with this? How did you deal with it? Other people know exactly how it feels. They live it as well. Often we take these things and want to be alone with them because they're so hard to think about. So it's a big step to let other people in. I understand that, but it's so helpful. If you could find one person who has diabetes and tell them and ask them if they're carrying the same problem and they're having the same issue as you do, I just want you to try one person. Find one person, someone someone you meet at a grocery store, someone you see once in a while. Just try it and see what happens when you share. And that's why for children, we have these camps. It has really been shown the 1 week a year to change how they take care of themselves for the whole year. It's like a pep talk. It's like someone running beside you doing exactly what you're doing. So please, if you can, find someone and share your fear. If they have diabetes, they have diabetes, they're doing the same thing as you are. So, one sentence that changes everything. I want to talk about how I'm feeling about this, not just my numbers. If you can say that in your meetings with your physicians or even online, type it. However it gets communicated, say it or write it or tell people that are advising you about your numbers, a nurse, a doctor, a PA. Because here's what I know from research and from years of practice. When patients feel generally heard, not just managed, not just pushed through to get to the next patient, their engagement with treatment goes up. Their outcomes get better. So what I mean is they take better care of themselves. They want to learn. Knowledge is power. The more you learn about what people do, I mean, you can type online, you know, what do people do, who first get diagnosed with diabetes? You can type your idea just to start. If you look at a source like the American Diabetes Association or a medical organization, it's most likely to be more reputable, or a hospital organization. Emory has online things, and so do other medical schools all over the country. That's more reputable than Reddit or Facebook. But there's so much out there, really. Your emotional experience of this, and how you feel, is not a distraction from your medical care. It's very often to say, well, my doctor doesn't care about this. Well, it's part of your medical care because it's part of how you feel about yourself and how you're treating yourself. So you're allowed to ask your provider for agreement and about your questions. So to sum this up, fear is not a sign that you're failing. It's a sign that you're paying attention. And paying attention exactly where your healing starts. I don't know if anybody wants to write what they're, this will not be, your name will not be published or, written with this. Does anybody want to ask or tell us any fears that you're having that we can address? I realize there aren't a lot of people on here. Okay, well, if I can answer any questions, I'd be happy to. Carla?
Hey, I'm here. So can you see the chat box, Jane?
Oh, now for some reason it was off. Okay, sure, I see it now. Okay.
Yes. Jenny said, not a question, just saying, Kobe, don't be afraid to begin again. And even if you're 2 months into 3 months, keep it up. Thank you, Janie.
Oh, you know what? That's really great. You're right. You're right. You can always start again. And there's a question from something she said about earlier about starting healthy habits late. I think you may be referring to the fact that I said, you can't start everything all at once. It's a lot to focus on medication, diet, exercise, and food all at once. I think that might be what you're referring to. And working with your care team to say, like, how can I begin? And where do I begin? And having someone sort of map out, where do I start? I think that's what you might be saying. Yeah, you can't start everything all at once. So, Jamie, are you saying that fear matters, but I understand it does not impact A1C?
No, she said, you said something about practicing better habits right before an appointment doesn't matter.
Yes, because that A1C number is based on 90 days. It's based on 3 months. So doing something for a week is not going to matter. And I tell people, if you're having trouble managing something, try to do 80% of it. You can't be perfect. If you have, 1 or 2 or 3 meals a week that you don't do as well as the other meals, just keep going. Um, so, right, it doesn't. The first 1 or 2 weeks doesn't matter. Like I said, it's not just the 90 days. It's looking at 90 days continuously, going. It's the whole pattern of how your blood sugar is doing. Over years that cause complications. So it's not 1 week or even 1 month. I don't know, Carla, was that more what she was saying?
Well, this is she said it doesn't matter for the particular A1C measurement, but it matters. It matters for the next A1C. That is my fear. My doc will react to the A1C from before and not what I can do to improve the next reading.
Okay, I get that. I get that. So the question is, how do you communicate that? I understand. Um, I think you have to tell them that. Um, and prepare something to go in. It's very hard because you're feeling, nervous to go in there. But like I said, if you have it on a piece of paper written down and you can say, this is what I want to talk about. And even if you can't read it, you can give it to them and you can say, I want to take care of myself, but I'm feeling so badly about my last A1C that it's hard to feel as good as I need to going forward. It's not easy, but a piece of paper, a big piece of paper, taking it in with you um, is an easy way to do it. I don't know if that helps. Um, it's also something to think, try it, see how it works. It may be, see if there's a nurse practitioner or a PA in that practice. Some people do better not seeing the physician. Don't be afraid to change.
Okay, Janie, I see your message. You are starting. I go through.
Starting with a new primary care, but after having the same birth, I had to go.
Gotcha.
Well, that's great.
Yeah, sometimes you just have to keep trying, Janie. And I'm so happy that you finally found someone who is listening to you. Is that you're saying? Yes. Someone who is listening to you. And if you guys visit our YouTube channel, there is it should be on there. If not, I have to go back and find it. But we did have a um pharmacist, I think, if I remember, she came on and we discussed how to have conversations with your doctors, with your primary care providers, and how to state your concerns without feeling, scared. If someone comes in with, they're telling you you're doing this wrong or they're not listening to you. So it was just a webinar on how to better communicate and how to, set the stage for a healthy relationship with your doctor, because that's who you are seeing, you know, constantly. So if you guys check out our YouTube channel, it should be on there. If that's something you're interested in learning more on how to, have a safe space of communicating with your doctor, let me know and we can arrange that. Oh, okay. Gotcha, Janie. You moved. Your fears that your new doctor will not be receptive.
Okay. Okay.
She said the info was timely, just saying, okay, Janie. Well, yeah, maybe check out our YouTube channel if you can find that video. If not, I'll try to find it and post it on there. Great tips on there on how to communicate with your new doctor. And don't be afraid. I know you said you're a little scared, but don't be. Go in there, like Jane said, have a list of your concerns, communicate with them, and stay firm. And if your doctor's not listening to you, just know that you can always walk away and find someone who will listen to your concerns.
Can I add something?
Yeah.
Your doctors want you to be a team player. They can do their job better if you say to them, I want to work with you to take care of my diabetes. They get frustrated if there's no conversation, if there's no input, and they're not really understanding who you are or how you feel. So if you walk in there and say, I need someone to work with me, that's a good thing. You're allowed to say that because this is about your health and this is why they went into the practice that they're in. So I think going in there and even writing your first question on a piece of paper, will you work with me? I need someone to work with me, to support me. It's very real and it's very fair to go in there and say that. And that's what they want. They want to hear that.
Thank you, Jan. Are there any more questions on the material we went over today? If you have any questions, please put them in the chat. If there are no more questions, thank you so much. Wait, we have someone typing.
Oh, good.
Let's wait. Esther, yes, this is recorded. Teresa said, thank you. Esther, this is recorded and it will be published on our YouTube channel. Jeannie
Thank
said,
you all
thank
for
you.
listening.
Esther said, thanks. Okay. So, well, I'm taking that as a sign that there are no more questions and everyone's saying thank you. Thank you, everyone, for joining us. Today is WOW Wednesday. Thank you, Jane, for, lovely presentation. We will see you guys next WOW Wednesday, which is, let me see, we're looking at April, every fourth Wednesday of the month. April 1, 2, 4, April 22nd. So just keep that in your calendar. If you're subscribed to our newsletter, you'll receive an email with the information and the registration link. Next Wednesday is April 22nd. I don't think we have a topic yet, but if there are any recommendations, please let me know in the chat what's something you're interested in learning more about. But yeah, if there are no more questions, we will see you all next WOW Wednesday. Have a lovely day. Go outside, enjoy the sun. The days are getting warmer. It's never too late to start healthy habits. So it's getting warmer. Go on your walks, grab a friend, enjoy a nice stroll down the neighborhood, pickleball. Just get out there, exercise. Don't be afraid. If there are any questions, comments, you can always email us at diabetesatlanta.org. That's our email. You can always, chat with me in here if there's something you want to let us know. But yeah, everyone take care. We will see you next WOW Wednesday.